Hello everyone, welcome back to our channel. What if your body was trying to tell you something important? Would you recognize the signs? Some health conditions progress quietly, with subtle symptoms that are easy to overlook. One of the most concerning is pancreatic dysfunction, which often shows no obvious warning signs until it becomes serious. The pancreas is a powerhouse organ, hidden deep in the abdomen, responsible for digestion and blood sugar control. When issues arise, they can manifest in ways that might seem unrelated, like changes in weight, appetite, or digestion. Recognizing these signals early could be the key to better health outcomes. In this video, we'll explore 10 essential signs that could indicate your pancreas needs attention. Staying informed can help you make proactive choices and seek timely medical advice. Let's dive in and uncover what your body might be trying to tell you. 1. Blood clots for no apparent reason. Blood clots are the body's natural response to prevent excessive bleeding in case of injury. However, when they appear for no apparent reason, they can be a warning sign of something much more serious, such as pancreatic cancer. This condition is called thrombosis and can occur in the veins of the legs, known as deep vein thrombosis, or even in the lungs, causing a pulmonary embolism, which is potentially fatal. In the context of pancreatic cancer, clot formation is related to substances released by the tumor. These substances can alter the body's natural balance, increasing the tendency of blood to clot. Additionally, cancer can trigger systemic inflammation that contributes to clot formation. These clots can cause symptoms such as swelling, pain, and redness in one of the legs, or sudden shortness of breath if the clot travels to the lungs. One of the challenges is that clots can easily be attributed to other health problems or even ignored, especially when symptoms are mild. Therefore, it is essential to pay attention to additional signs. If you notice that you are experiencing pain or swelling in one leg, difficulty breathing, or chest pain, seek medical help immediately. The presence of clots can be one of the first signs of pancreatic cancer, often appearing even before other more obvious symptoms. Another important point is that cancer treatments such as chemotherapy can also increase the risk of clots, making medical attention even more crucial. Often, people with pancreatic cancer only discover the disease after complications related to blood clots. Therefore, never underestimate this symptom, especially if it appears suddenly and without an apparent cause. Clots are a sign that something is not working as it should in the body. Detecting the underlying cause in time can save lives. Be aware of what your body is trying to tell you. Unexplained clots are more than an inconvenience, they can be an early warning of a serious problem. Don't ignore the signs. They can be the difference between an early diagnosis and the late discovery of a fatal condition. 2. Constant fatigue that doesn't get better. Feeling tired after a busy day or a bad night's sleep is normal. But what happens when the feeling of tiredness is constant, deep, and does not improve even with rest? This persistent fatigue could be a symptom of something much more serious, like pancreatic cancer. In the case of this type of cancer, fatigue is caused by a combination of factors. One of the most common is nutrient malabsorption due to the inability of the pancreas to produce enough digestive enzymes. This means that even if the person is eating, the body cannot extract the necessary energy from food. Additionally, pancreatic cancer can cause loss of appetite, further aggravating the lack of energy. Another significant factor is the impact of cancer itself on metabolism. The body expends a huge amount of energy trying to fight illness, which can lead to exhaustion. Treatments such as chemotherapy can also intensify fatigue, adding side effects such as weakness and a reduction in the body's ability to recover. cancer-related fatigue is different from simple tiredness. It is persistent, profound, and affects the ability to perform even the simplest daily tasks. It's not something that goes away with a good night's sleep or a period of rest. This type of fatigue can be an important warning, especially when combined with other symptoms such as unexplained weight loss, abdominal pain, or digestive changes. Often, people underestimate fatigue, attributing it to stress or age. Therefore, it is essential to pay attention to additional signs. If you or someone close to you is experiencing persistent fatigue that doesn't improve, seek medical help. Fatigue can be one of the first signs that something is wrong in the body. In the case of pancreatic cancer, detecting and treating the underlying cause early can make a huge difference. Never ignore extreme and unexplained tiredness. Your body is trying to tell you something. Paying attention to this symptom could be the first step to saving your life or that of someone you love. 3. Persistent itching of the skin. Itchy skin may seem like a trivial problem, but when it is persistent and intense without an apparent cause, it can be a sign of something more serious, such as pancreatic cancer. This uncommon but significant symptom is often linked to the buildup of bile salts in the blood. In the context of pancreatic cancer, tumors in the head of the organ can block the bile ducts, preventing the normal flow of bile into the intestine. This obstruction leads to the retention of bile salts in the bloodstream, resulting in itching, known as pruritus. The itching associated with pancreatic cancer is often more intense at night, making sleep a challenge. It may not be accompanied by a visible rash, which makes many people delay seeking medical help. Another important sign that often accompanies this itch is jaundice, characterized by the yellowish color of the skin and eyes. This is because the same blockage that causes the buildup of bile salts also results in high levels of bilirubin in the blood. Although itching can be caused by various conditions such as allergies, dry skin, or dermatological problems, it is essential to investigate whether it persists or is accompanied by other signs such as dark urine or pale stools. This symptom is not just uncomfortable, it is the body trying to warn you that something more serious may be happening. Chronic itching can affect quality of life, causing irritability, difficulty concentrating, and even skin wounds due to repeated scratching. Even more alarming, many people do not associate this symptom with pancreas problems, delaying diagnosis. If you are experiencing persistent, unexplained itching, especially if combined with signs such as weight loss, abdominal pain, or changes in your stool, see a doctor immediately. This simple symptom could be the key to identifying a serious problem such as pancreatic cancer while it is still in a treatable stage. Remember, your body is wise and always tries to communicate when something is wrong. Don't ignore the signs, no matter how small they seem. Paying attention to unusual symptoms could save your life. 4. Sudden diabetes. Diabetes is a known condition and is generally associated with factors such as obesity, physical inactivity, or family history. But the sudden onset of diabetes, especially in people over 50 with no apparent risk factors, could be a sign of something more serious, pancreatic cancer. The pancreas plays a key role in regulating blood sugar. It produces insulin, a hormone that allows the body's cells to absorb glucose to produce energy. When a tumor develops in the pancreas, this insulin production can be compromised, resulting in high blood sugar levels. This dysfunction can lead to the development of diabetes, even in individuals who have never had problems with glucose before. What makes this relationship even more alarming is that, in some cases, diabetes can be the first sign of pancreatic cancer, even before other symptoms appear. The onset of diabetes may indicate that something is wrong with the pancreas. Symptoms of new-onset diabetes include excessive thirst, frequent urination, fatigue, blurred vision, and in some cases, unexplained weight loss. These signs should be taken seriously, especially if they occur abruptly and without an obvious cause such as dietary or lifestyle changes. Although not all cases of new-onset diabetes are related to pancreatic cancer, it is important to investigate this possibility, especially in older people or those with a family history of cancer. Another relevant aspect is that in some patients with pancreatic cancer, diabetes may disappear after the tumor is treated. This reinforces the direct connection between pancreas function and blood sugar control. Unfortunately, many people do not associate the onset of diabetes with something as serious as cancer. This lack of awareness can delay diagnosis and allow cancer to advance silently. If you or someone close to you suddenly develops diabetes without traditional risk factors, see a doctor and ask for further investigation. Remember, the earlier pancreatic cancer is diagnosed, the greater the chances of successful treatment. New-onset diabetes can be more than just a change in your health, it could be the body warning you that something bigger is happening. Pay attention and act quickly. 5. Changes in stool or urine. Changes in the color of stool or urine can be subtle but very important signs of serious problems in the body, including pancreatic cancer. Normal stool is usually brown in color, while healthy urine ranges from light yellow to amber. When these colors change significantly and persistently, the body may be trying to warn you that something is not working as it should. In the case of pancreatic cancer, tumors can block the bile ducts, interrupting the normal flow of bile. Bile is responsible for the color of feces, and when its flow is blocked, feces can become clear, whitish, or even grayish. This change is a clear sign that the biliary system or liver may be affected. Additionally, urine may be significantly darker, even with adequate hydration. This darkening occurs due to the accumulation of bilirubin in the blood, which, instead of being eliminated through feces, is excreted through the kidneys. These signs may be accompanied by other symptoms such as jaundice, itchy skin, or abdominal discomfort, reinforcing the need to seek medical help immediately. Changes in stool consistency, such as greasy and strong-smelling stools, can also be an indicator of pancreatic cancer. These changes occur because the pancreas is not producing enough digestive enzymes to break down fats, proteins, and carbohydrates. This condition, called malabsorption, can lead to serious nutritional deficiencies and weight loss. Although changes in stool or urine may be caused by other factors such as diet, infections, or medications, it is essential not to ignore these changes when they are persistent or associated with other symptoms. Pancreatic cancer is known to be a silent killer, but the body often gives early warning signs. Detecting these changes and acting quickly can make a huge difference in diagnosis and treatment. Your body is always trying to communicate, and changes in excretions are a clear language that should not be overlooked. If you notice unexplained changes in the color or consistency of your stool or urine, see a doctor. These signs could be the key to identifying a serious problem at an early stage. 6. Loss of appetite. Loss of appetite is a symptom that often goes unnoticed. It may seem temporary, caused by stress, the flu, or even changes in mood. However, when the lack of desire to eat becomes persistent and inexplicable, it's time to pay attention. This condition, called anorexia in medical terms, is a common symptom in people with pancreatic cancer. In the case of pancreatic cancer, there are several factors that can cause loss of appetite. One of them is the presence of a tumor that compresses the stomach, creating a feeling of early satiety. A person feels full after eating just a small amount of food. Furthermore, cancer itself can alter the signals that the body sends to the brain, changing the perception of hunger and appetite. Another factor is the impact of cancer on the senses, such as taste. Foods that were previously pleasant can have a changed taste, discouraging the person from eating. In some cases, cancer treatments such as chemotherapy can also contribute to loss of appetite, causing nausea or changing the flavors of food. Loss of appetite in pancreatic cancer is particularly concerning because it can lead to a condition called cachexia. Cachexia is characterized by a significant loss of weight and muscle mass, even when calorie intake is adequate. This condition weakens the body, reducing the patient's ability to resist treatment and affecting their quality of life. Additionally, a lack of appetite can aggravate nutritional deficiencies, resulting in fatigue, weakness, and greater vulnerability to infections. Therefore, it is important to observe whether loss of appetite is accompanied by other symptoms such as unexplained weight loss, frequent nausea, or changes in stool. If you or someone you know is experiencing a persistent lack of appetite, don't ignore this sign. Seeking medical help can reveal the underlying cause and, in many cases, save lives. Your body needs nutrition to function properly. When it stops asking for food, something could be very wrong. Pay attention and try to act in time. 7. Problems in your digestive system. Digestive problems may seem routine to many people. Nausea, vomiting, diarrhea, or constipation are symptoms that we generally associate with something we ate or with episodes of stress. But in some cases, these signs can indicate something much more serious: pancreatic cancer. The pancreas plays an essential role in the digestive system. It produces enzymes that help break down fats, proteins, and carbohydrates so the body can absorb the nutrients it needs. When cancer affects the pancreas, this function can be compromised, resulting in symptoms such as poor digestion and significant changes in stool. One of the most striking signs of digestive problems related to pancreatic cancer is the presence of pale, fatty stools, known as steatorrhea. This occurs when fats are not properly absorbed by the body due to a lack of pancreatic enzymes. These feces can have a strong odor and float in the water, indicating that something is not right. Another common symptom is a feeling of nausea or frequent vomiting, which may be caused by a tumor blocking the normal flow of food through the digestive tract. Additionally, many people report abdominal discomfort and bloating after meals, even when eating in small amounts. These digestive problems can lead to serious nutritional deficiencies, as the body cannot extract the necessary nutrients from food. Over time, this can cause weight loss, weakness, and a general feeling of being unwell. The big challenge is that digestive symptoms can easily be attributed to less serious problems, such as gastritis or food intolerances. Therefore, people often do not seek medical help immediately, allowing pancreatic cancer to progress silently. If you notice persistent symptoms such as changes in the consistency or color of your stool, frequent nausea, or constant digestive discomfort, see a doctor. These signs, especially when combined with other symptoms such as unexplained weight loss or abdominal pain, should not be ignored. Paying attention to digestive problems can be the key to early diagnosis. Your digestive system is a direct reflection of your internal health. If something seems wrong, don't wait to act. 8. Abdominal pain. Abdominal pain is one of the most common and at the same time most neglected symptoms when it comes to pancreatic cancer. This pain can range from mild discomfort to an intense and persistent sensation located mainly in the upper part of the abdomen. What makes it even more worrying is its characteristic of radiating to the back, often confused with muscle pain or gastrointestinal problems. In pancreatic cancer, the pain is usually caused by the growth of the tumor. As the tumor grows, it presses on neighboring organs or nerve endings around the pancreas, causing pain. This pain tends to worsen after meals or when the person lies down, as these positions can further compress the affected areas. Over time, the pain can become constant, especially as the cancer spreads to other organs. One of the most challenging aspects of this symptom is that it can easily be confused with less serious conditions such as gastritis, indigestion, or even acid reflux. Therefore, many people ignore the initial pain or try to treat it with painkillers and home remedies, delaying the diagnosis. However, there are additional signs that can help differentiate pain caused by pancreatic cancer from common pain. For example, if abdominal pain is accompanied by unexplained weight loss, changes in stool, or jaundice, this could be an indication of something more serious. Another important aspect is that abdominal pain in pancreatic cancer tends to be progressive. That is, it worsens over time. It does not disappear completely and can be more intense at night, making it difficult to sleep and affecting quality of life. This progression is a clear warning that something is wrong and needs to be investigated. Don't underestimate the pain in your belly. If it is persistent, progressive, and accompanied by other symptoms, see a doctor immediately. Identifying a problem early can be the difference between effective treatment and late discovery of a serious condition. Your body is trying to tell you something. Listen to the signs before it's too late. 9. Losing weight without dieting. Losing weight without dieting or exercising may seem like a dream to some, but in reality, it's a sign that shouldn't be ignored. Unexplained weight loss, especially when it occurs quickly and significantly, can be a warning of serious health problems, including pancreatic cancer. This type of cancer can cause weight loss for several reasons. Firstly, the pancreas plays a crucial role in digestion, producing enzymes that help the body absorb nutrients from food. When the pancreas does not function properly due to the presence of a tumor, these enzymes are reduced, resulting in poor absorption of nutrients. Without the necessary nutrients, the body begins to burn its own energy reserves, leading to weight loss. Additionally, tumors in the pancreas can press on the stomach, creating a feeling of early satiety. This means that the person eats less because they feel full quickly, further worsening weight loss. Another factor is the increase in metabolism caused by cancer. The body, when fighting the disease, uses more energy than usual, which also contributes to the reduction of body weight. People often don't notice weight loss right away. It may start subtly, with clothes becoming looser or comments from friends and family about how slimmer you look. However, a loss of more than 5% of body weight over a period of 6 months to a year without lifestyle changes should be a cause for concern. Although weight loss can be caused by other conditions such as diabetes, thyroid disorders, or stress, it is essential to seek medical help to investigate the cause. In the case of pancreatic cancer, weight loss is often accompanied by other symptoms such as abdominal pain, nausea, or changes in stool. If these signs are present, do not delay seeing a doctor. Detecting the cause of weight loss early can save lives by allowing for earlier diagnosis and more effective treatment. Remember, your body doesn't lose weight drastically for no reason. Listen to the signals and act quickly. 10. Change in skin color. Jaundice is one of the most visible and worrying signs that may indicate pancreatic cancer. This condition causes the skin and whites of the eyes to turn yellow due to an increase in bilirubin in the blood, a yellow pigment that the body produces when it breaks down red blood cells. Normally, bilirubin is processed by the liver, mixed with bile, and eliminated through the digestive system. But when there is a blockage in the bile ducts, such as a tumor pressing on these ducts, bilirubin builds up, resulting in the characteristic yellowish color. Additionally, jaundice may be accompanied by other symptoms such as dark urine, light-colored stools, and intense itchy skin. These signs are more than just a nuisance, they are an alert that something is wrong in the liver, biliary system, or pancreas. In the case of pancreatic cancer, jaundice may be the first noticeable symptom, even before other signs appear. This is because tumors located in the head of the pancreas, one of the most common areas for the development of this type of cancer, can quickly block the bile ducts. People often ignore the first signs of jaundice, associating them with less serious problems such as tiredness or poor diet. This procrastination allows cancer to advance silently. Therefore, it is crucial to seek immediate medical attention when you notice any yellowish color on your skin or eyes. Jaundice can have other causes such as hepatitis, cirrhosis, or gallstones, but a medical examination is essential to determine the source of the problem. Identifying this symptom early can make all the difference. If diagnosed early, pancreatic cancer can be treated more effectively, significantly increasing the chances of successful treatment. Attention to detail is key. If jaundice is accompanied by other signs such as unexplained weight loss or abdominal pain, it could indicate an even more serious problem. Pay attention to what your body is telling you, it may be sending a cry for help. Your body has a way of signaling when something isn't right. Subtle changes like unexplained weight loss, digestive issues, or persistent fatigue could be important messages that shouldn't be ignored. While some health conditions develop silently, recognizing early warning signs can be life-changing. At Healthy Care, we believe that knowledge is power. Being aware of these signals and taking action early can lead to better health outcomes. A simple checkup could provide peace of mind and help you or a loved one stay on top of your well-being. Prioritizing your health doesn't have to be complicated. Maintaining a balanced diet, staying active, and making regular health screenings part of your routine can go a long way in preventing future issues. Small, consistent steps today can lead to a healthier, stronger tomorrow. Your health is your greatest asset, take care of it. If you found this information valuable, share it with those you care about. Staying informed and proactive can make all the difference. Let's continue this journey together toward a healthier life.